Bismillahirrahmanirrahim. I am Dr Madiha Butt, working as a cardiologist at PF Hospital, Wacken. On the day of World Hypertension Day, as you know that the World Hypertension League has postponed the day of World Hypertension due to COVID-19 pandemic. So it's been celebrated on 17 October 2020. The theme of the World Hypertension Day of this year is measure your blood pressure accurately, control it, live longer, and the way of improving the measurement of the blood pressure accurately. World hypertension be diagnosed as when the systolic blood pressure of equivalent or greater than 140 millimeter of mercury and the diastolic blood pressure of equivalent or greater than 90 millimeter of mercury in the office or clinic following a repeated examination. As you know, the world hypertension, they remain the leading cause of the death worldwide, accounting for approximately 10.4 million deaths every year. So it's very important to diagnose the blood pressure early. The world hypertension has been divided into a normal blood pressure of less than 130 by 80 millimeter of mercury. It can be a high normal where the systolic blood pressure of 130 to 139 millimeter of mercury and diastolic blood pressure of 85 to 89 millimeter of mercury. Here the high normal blood pressure is very important because to identify the individuals, these individuals are the one who can benefit from their lifestyle modifications. So lifestyle modification is very important and they need only pharmacological therapy only if there is a compelling indication like diabetes mellitus, hyperlipidemia, smoking, metabolic syndrome. Then comes the grades of hypertension. As everyone knows, they are divided into the two grades of hypertension. The grade 1, here the systolic blood pressure is 140 to 159 millimeter of mercury and the diastolic blood pressure of 90 to 99 millimeter of mercury. And the grade 2 hypertension, in which the systolic blood pressure of equivalent and greater than 160 millimeter of mercury and the diastolic blood pressure of equivalent and greater than 100 millimeter of mercury. So these groups of the patient should be identified so that the treatment can be started. Then comes, before going to the detail of pharmacological treatment of blood pressure, it is very important a thorough physical examination of the patient is very important, because it can not only to help to assist the diagnosis of hypertension, but it can evaluate the secondary causes of the hypertension which is usually messed up, and these are the secondary hypertension causes which can be treated, which are the reversible cause. If you treat the secondary hypertension, you can cure the hypertension and the patient can save from the pharmacological treatment. So very important to diagnose the secondary causes of the hypertension. Then comes the laboratory investigations, where the baseline investigations as well as the electrocardiography is very important to diagnose the changes of hypertension like left ventricular hypertrophy, atrial fibrillation and ischemic changes, and also to identify the additional cardiovascular risk factors. Approximately the 50% of the patient with hypertension, they have an additional cardiovascular risk factors like smoking, diabetes mellitus, hyperlipidemia, metabolic syndrome. So it's very important to identify the other cardiovascular risk factors. Then come the treatment of the hypertension. The very important treatment is lifestyle modification. Lifestyle modification is very important for high normal as well as in the grade 1 and the grade 2 hypertensive patients. Lifestyle modifications, they include, as you know, they include the weight reduction, smoking cessation, moderate intensity physical activity. At least 30 minutes of moderate intensity exercise is required on 5 or 7 days of the week. It can reduce a systolic and diastolic blood pressure very significantly. So it's very important the patient should be trained according to their lifestyle modifications, smoking cessation, healthy diet which is rich in the fruits, vegetables, polyunsaturated fatty acids. Patients should be counseled in detail about their lifestyle modification and diet counseling. Then comes the pharmacological treatment. The less than 50% of the patient in the society, they are not taking hypertensive drugs. Even they are not aware that they are being hypertensive. Only less than 50% of the patient, they are taking pharmacological treatment. So it's very important to diagnose the hypertension and to counsel the patient regarding their lifestyle modification and about their pharmacological treatment. and the drug that they should be started, the patient should be compliant about their treatment, and the drug they should be considered regarding the drug therapy for hypertensive patient, the drug should be cost effective, the drug should be tolerant to the patient, the drug should be considering that one daily dose regime हो, not polypharmacy करें, multiple dosage use ना करें, patient के लिए compliance नहीं होगी, तो always started with a single drug, take it to the maximum level, then add on therapy. Obviously, if the hypertension is not controlling with a single drug, so you have to add on therapy. So at the end of this talk, I want to say that you have to control your blood pressure. You have to, first of all, you have to measure your blood pressure. It's very important that you have to accurately measure your blood pressure that you are a hypertensive. तो blood pressure का वही control का, अगर आप blood pressure पे control करेंगे तो it means कि आप अपनी ज़िंदगी पे control कर सकते हैं. Thank you.